Hey everyone, this is Dr. Kiley O'Neill, owner and physical therapist at Calhoun Wellness Collective. Today I just wanted to go over the presentation I did this past weekend on pelvic PT. We named the course Not Your Mother's Kegel Exercises because we've really gotten away from that over the years and started to transition to other techniques to improve pelvic issues that women are facing. So a little bit about me. I'm married to my husband. We have a almost 2-year-old daughter. She was born at home. We did a home birth with a midwife, and that was an incredible experience. And I have baby girl number 2 on the way, who's due in July. So I'm a very holistic-minded, crunchy, quote-unquote mama. I prioritize clean eating, clean living. Whenever I was biking with my dog during COVID, I went over a speed bump and really kind of bruised my tailbone and strained my pelvic floor muscles. And so that was my introduction to pelvic floor physical therapy, is because I was having so much pain sitting. So I asked one of my friends if she could kind of help me out. And without even doing any type of internal exam, she helped me realize I wasn't relaxing my pelvic floor muscles whenever I took a breath and inhaled. And so that was really just kind of like eye-opening, just to see how quickly my pain could resolve just with a little bit of corrective exercise. I worked 6 years well, I guess this is year number 7 of outpatient orthopedics. My philosophy as a PT and just as a mom or human is finding the root cause of issues and not just masking it with pain medication or, over-the-counter products, because it's just going to make you feel worse and worse. So I specialize in orthopedics, but also TMD or TMJ, as well as connective tissue disorders. I don't know if anyone's heard of Ehlers-Danlos syndrome, but even if you don't have Ehlers-Danlos syndrome, if you're hypermobile, that can affect you externally as well as internally. And then, of course, pelvic PT. I don't treat men at this clinic. That's just not something that's in my skill set or specialty. But if anyone needs that, there are PTs out there who treat men for pelvic issues. In my free time, my hobbies include baking, working out, and reading. So before we begin, let's define proactive versus reactive healthcare. Proactive healthcare is more preventing crisis, focused on optimizing health, empowering the patient to take control of their health, and then the lifestyle you live is foundation to that. And your goal is to just live long and well. Versus reactive healthcare, which is what our Western medical system is set up for. It responds after crisis. It's focused on symptoms. Patient is very dependent on the medical system. Meds and pharmaceuticals are the foundation, and saving your life is the only goal. And here's why I harp so much on proactive healthcare, is because it's a slippery slope if we're not taking initiative to optimize our health. Is, say a woman comes to the point in life where she's starting to have leaking. Let's say she's had, a couple kids. Then she's going to maybe stop exercising in the gym and lifting weights because she's very self-conscious of that leaking, which is going to decrease her bone mass or her bone mineral density as well as her muscle mass. And then she's at an increased risk for falls, especially as she gets into her later years of life. Once she falls, she could most likely get a hip fracture, which will put her in the hospital, where, especially in the wintertime, not moving around, she could acquire hospital pneumonia and then face an early death. So this is, a worst case scenario of doom and gloom. Not saying everyone's going to end up dying at the beginning, but just catching things now can lead to a better quality of life later on. Our objectives for the next hour are going to be to learn what the pelvic floor is, learn some facts about the pelvic floor, screen for your own pelvic floor dysfunction, learn the broad and vast array of topics relating to pelvic PT, understand how posture influences the pelvic floor, understand how the pelvic floor and diaphragm work together to create a pressure system, differentiate stress incontinence versus urinary incontinence versus urinary frequency and urgency, know what Kegels are and when they are appropriate, understand how nutrition can influence the pelvic region, know who's on your team, and know what steps you can take starting today to improve your pelvic health. So what is the pelvic floor? It's a group of muscles or ligaments and tissues located at the base of your pelvis, slung across the bottom of the pelvis like a hammock. So it's going from one sit bone to the other sit bone, your tailbone to your pubic bone. Functions: it allows you to hold back urine and also allows you to urinate when you need to. It supports the abdominal organs, including the bladder. It aids in sexual function, and alongside the diaphragm, core, and your back muscles, helps to stabilize the trunk. So if you picture a soda can, the pressure that's created, think of the top of the soda can as your diaphragm, bottom is the pelvic floor, the walls of the soda can are going to be your back and core muscles. How do you find your pelvic floor? The number one way I use in the clinic is have patients lay on their side with their top leg kind of bent up, um, and almost like you're side sleeping, and then put your hand on your bottom, in the pelvic floor region, so between your butt crack and your pubic bone, right on the vagina. And whenever your hand is there, I want you to take an inhale. And as you inhale, you should feel your pelvic floor expand into your hand or blossom into your hand. If you don't feel it whenever you inhale, then that means you're probably isometrically just holding tension in the pelvic floor. And so sometimes I'll give a little bit more pressure with my hand just to give biofeedback. Or occasionally I'll have patients say, act like you're having a bowel movement. And as you inhale, push into my hand. And then they start to get that connection. And then I say, okay, back off the push, but just let it naturally lengthen. Also, when you're urinating, if you stop midstream, that's engaging your pelvic floor. I don't encourage you to do this all the time or even as an exercise, because when you're on the toilet sitting, that's putting a lot of stretch on our pelvic floor, and we don't want to contract the muscle whenever it's at its end range. Also, you use your pelvic floor to hold back gas. If you are in a sitting position, you can roll up a towel and try to squeeze it. And then in the clinic too, or at home, you could also insert a finger or a thumb and try to clamp the vagina closed around it. So that would be engaging your pelvic floor. Some facts: you don't always need to get your muscles stronger. So this is a big kind of trend that we're moving away from Kegels for pelvic floor therapy. Kegels are those, pelvic floor squeezes. And we're getting more towards just addressing breathing patterns and actually lengthening the pelvic floor, because most women that I see in the clinic tend to hold their pelvic floor just like tight, and their glutes, they kind of stand with their glutes squeezed, just like people tend to hold their jaw tight and just, hold tension there. So men can have pelvic floor issues too. If there's any men, there's great books called Headache in the Pelvis and Pelvic Pain, the Ultimate Cock Block by Susie Gronsky. The average woman waits a shocking 8 years to report her condition to anyone, including her own physician, which is insane. So we want to catch it early, 50% of women will experience incontinence at some point in their lives. It's the number one reason for nursing home placement. Family members just can't handle the demands of doing pericare and changing adult diapers, the Depends and things like that, and they need help for those things. And this shouldn't be a normal part of aging. It should not be inevitable with childbirth. You shouldn't be able to tell the difference between a strength workout, or like a patient recovering from a low back injury, and a pelvic floor rehab patient at the end of the rehab process. So here at Calhoun Wellness Collective, we have the squat rack set up. We have barbells, dumbbells, all the things, because life demands that we're able to manage load well. And so we want to replicate that in the clinic and make sure you can lift a barbell or, do things like a jumping jack without leaking. Many times women with frequent negative UTIs are actually having burning pain due to pelvic floor muscle tightness. So this one is huge, because doctors, even when patients get those negative UTIs, will say, I don't know what else to tell you other than here's another round of antibiotics. And antibiotics can have really detrimental effects on our gut health and overall health. So that's why we want to avoid them. And if you're having negative UTIs, it's important to see a pelvic floor physical therapist to see if it's actually tightness in the pelvic floor causing your pain. Pelvic floor dysfunction, tenderness, weakness, and the presence of pelvic organ prolapse are all highly correlated with lumbopelvic pain in women. So back pain is very common in, women that are dealing with pelvic pain too, because it all comes down to that pressure system. Think of the soda can I was talking about. If you dent a soda can, like, that pressure has to go somewhere else if you haven't opened the soda can. So it's going to stress, other areas of the body. We want to manage pressure well. And then it's never too late to sort out your pelvic floor problems, even, in your 90s, if you're dealing with incontinence or pain with intercourse, things like that. Like, you don't have to suffer silently. We can take care of that and really change quality of life. And your bladder should not rule your life. So you shouldn't be constantly worried about if you have enough pads to go in your underwear or where the next bathroom is. So we can screen for pelvic floor dysfunction using the Cosine pelvic dysfunction screening protocol. So if you just kind of hold up your fingers, as any of these apply to you, once you have 3 fingers, then you're definitely a candidate for pelvic floor physical therapy because you have some dysfunction going on. But that's not to say, even if you have 1 or 2 symptoms, you wouldn't be a candidate. You could still certainly benefit, but 3 is just kind of screaming pelvic floor dysfunction. So I'll go ahead and read through these. I sometimes have pelvic pain in the genitals, perineum, pubic, or bladder area, or pain with urination that exceeds a 3 on a 1 to 10 pain scale, with 10 being the worst pain imaginable. Number 2, I can remember falling on my tailbone, low back, or buttocks. That's me. Even if it happened years ago, that still counts. Number 3, I sometimes experience 1 or more of the following urinary symptoms: accidental loss of urine, feeling unable to completely empty my bladder, having to void within a few minutes of a previous void, pain or burning with urination, difficulty starting or frequent stopping, starting of urine stream. Number 4, I often or occasionally have to get up to urinate 2 or more times a night. Uh, Disclaimer, some of these don't really apply if you're pregnant because baby's putting pressure on the bladder. So if you're waking up multiple times in the night, I kind of say that one's just a little tangent to the side, exception to the rule. Okay, next one. I sometimes have a feeling of increased pelvic pressure, the sensation of my pelvic organs slipping down or falling out, or just like feeling really heavy in that pelvic region. I have a history of pain in my low back, hip, groin, or tailbone, or have sciatica. Next, I sometimes experience 1 or more of the following bowel symptoms: loss of bowel control, feeling unable to completely empty my bowel movement, straining or pain with a bowel movement, or difficulty initiating a bowel movement. Next, I sometimes experience pain or discomfort with sexual activity or intercourse. Next one, sexual activity increases 1 or more of my other symptoms. And then the last one, prolonged sitting increases my symptoms. If you check 3 or more of the boxes, again, pelvic floor dysfunction is likely. And while I don't think I talk about this in my presentation anywhere, but it just reminded me seeing that second to last one about sexual activity. If you're having a really achy pelvic floor for hour, 2 hours after sexual activity, and it's just been kind of like a recurring theme, that's something that we want to actually consider if you have pelvic vascular dysfunction, where you're getting all that blood flow to the pelvic region, those muscles, but your veins are not doing a good job of shunting the blood flow back to the heart after. Or if you have leg swelling on your left leg compared to your right leg. So there's some things to look out for too, that we may need to screen for that and refer you out. All right, topics covered in a pelvic PT session. This is not all inclusive, and this does not mean we talk about this with everyone, but if you're pregnant or just, preparing for labor, we would, see you leading up to the delivery and then postpartum. Scar mobility. So if you've had abdominal surgery, cesarean, perineal tears that were sutured, vaginal tearing, things like that, and you're just, dealing with some tight scar tissue, or if you had a low back fusion, anterior approach, that can also really influence your pelvic floor dysfunction. Next, posture, breathing patterns, and then diastasis recti. So that's whenever you're pregnant and baby's, growing, so your abs separate, and some women just really deal with some significant separation after, whether it be deep or wide. And the good news is no matter how deep or wide your gap is, that does not always correlate to your quality of life after. So we can really achieve, your ability to go back to what you love doing and try and obviously lessen the gap. But yeah, I just want people to keep in mind that cosmetically doesn't always relate to function. Next, looking at core function, so the different slings of the core region, prolapse, exercise, if you're struggling with exercise and leaking or things like that. Bladder habits and incontinence, even if it's just a little leaking, we still want to address that. Bowel habits, at least twice a day is ideal. Are you dealing with constipation or bloating? We may need to refer you to a functional medicine practitioner or GI or someone if you're dealing with bloating that we think is more GI related. Or, like I was talking about in that last slide, pelvic vascular dysfunction or disease could also cause some bloating in the lower abdominal region. We want to talk about nutrition and nourishment, menstruation, sleep, sex, vaginismus to penetration, or even if it's just a tampon that's really painful. And keep this in mind too that teenagers can deal with vaginismus if they, went through any type of psychological trauma that caused them to start carrying tension in their pelvic floor, or like even just gymnasts who are really athletic or dancers who tend to hold that tension in the pelvic floor, teaching them how to relax their pelvic floor too. During our pregnancy and labor prep appointments, there's a million things we could talk about. Modifications to exercise, maintaining thoracic mobility because we tend to get stiff in that thoracic spine as we become more and more pregnant. Working on hip mobility to make labor and delivery easier, as well as different pushing positions that can really make labor easier because when you're laying on your back, that doesn't let the sacrum move, the tailbone region. And so then that closes the pelvic outlet instead of letting it open up like it would if you were on your hands and knees. We can talk about open versus closed glottis pushing and how that affects the pressure system. Pain management, using a comb or say your partner can provide counter pressure to your hips to manage pain. For some of my ladies interested in Christian scripture, there's a great app called Christian Hypnobirthing Tracks. Even though it says hypnobirthing, it has nothing to do with hypnotism. It's just really a soothing, calming scripture that just keeps you grounded during that time. Next, different ways to leverage oxytocin because oxytocin is that feel good hormone that's going to send you into labor and then it's going to help keep you relaxed during the contraction process of labor instead of getting in a stressed out state. Collecting colostrum, we can always refer you out to a lactation consultant too for that. But like even just while my patients are doing their PT exercises, I'm just sprinkling knowledge in case their OBGYN hasn't covered any of these topics. Perineal massage. So the perineum is the external opening of the vagina, and that's where women are likely to tear. So if we start doing some perineal massage leading up to delivery, then your risk of tearing is less. Hemorrhoid management, this one's a crazy one. So if you're dealing with hemorrhoids, and this is for pregnant ladies or, anyone in general, there's research that if you put sugar on a wet cotton ball and then put that, in the area of the hemorrhoid and then put your underwear back on and go to bed the next day, it's significantly less. I'm not ashamed to admit I did try that when I was pregnant and dealing with one little hemorrhoid and it worked. So yeah. All right, next, gentle laxatives for bowel movement after birth. That one, I don't say everyone needs to take a laxative. I'm not the one to say it too. That's up to your doctor and discussing that with them. But that can really help for those first bowel movements after giving birth that could tend to be painful, as well as peeing after birth can be painful. So I tell women, have that warm peri bottle in your bathroom. It's not going to stay warm. So every time you got to go to the bathroom, just dump it real quick, fill it real quick. And that's going to really make it a lot more soothing to go to the bathroom to urinate, as well as staying hydrated. Because if you're hydrated, that's going to dilute the urine so it doesn't burn as bad. But the last trick is just the football position of putting your hands on the floor in front of the toilet while you're urinating, and that way your urination, the urine doesn't go anywhere near the vagina where you could have teared or have, some trauma. So you're not going to get that stinging pee as much. So yeah, just some little clinical pearls there. Next, on the right side, we have core connection. So hug the baby exercise. That one a lot of people can do incorrectly. So teaching how to draw in and up from the lower abdominal region instead of the upper abdominal region. Teaching women, hey, you can make a padsicle with a diaper. Just get some sonic ice, tear the diaper open on the end, and dump that ice in, and that could be a great ice pack. How to improve upper back pain from breastfeeding. Number one, positioning is really the best thing you can do. So the My Breast Friend pillow is a great option. And then foam rolling in between, or once a day if you can, at least. Heat, warm baths. Those are all going to help. Well, not warm baths right away. I shouldn't say that because we're not supposed to. So yeah, more heating pad and then just stretching. We'll go over C-section scar recovery. Again, that too you're not going to do right after a C-section, but once the incision has healed. Perennial tear management, same thing. Discussing postpartum fatigue, rage, or depression, referring patients out is really important because as a PT, I may get to spend the most time talking with you about how you're doing. And so I can pick up on those things and get you the support you need. And then at my office, I offer hair tissue mineral analysis. We want to do that 3 months after birth because HTMA tests give you a snapshot for the last 3 months. And so we want it to reflect how you're doing with depletion status while you're breastfeeding. And if we do it right after birth, it's going to tell you how you were doing before baby was born. Discussing healthcare, your team for postpartum support, who you're going to have in your corner to help you out. And then returning to physical activity and fitness. What's your game plan for that and how I can help you? So whenever we're talking about breathing, we need to be chest and belly breathing, a mixture. We don't want to just be chest breathing. We want to check for lateral rib expansion whenever we're breathing versus just the front of our ribs coming up. And so I often have my patients wrap their hands like they're giving themselves a hug and hold their ribs on the sides of their body and then take an inhale and feel those ribs expand, laterally. And so that's one way to practice that umbrella breath, we call it, where it's rib cage expansion 360 degrees. We don't want to be holding our breath whenever we have a bowel movement. We want to be nice and relaxed. So if you're holding your breath and straining, then we need to figure out why. And then during exercise, for the most part, the recommendation has always been if you're holding your breath and valsalving, then you're probably lifting too heavy, so we need to back off a little bit. But with that said, I did just see a research article come out that women were valsalving while lifting weight and it didn't affect the fetus. So kind of mixed reviews on that. We'll see where that one goes. One thing you can do at home too is just lighting a candle that smells good. Obviously, non-toxic is what we prefer. Here at Calhoun Wellness Collective, we sell Fontana Candle Company candles, which are fragranced with essential oils, not toxic fragrances. Or essential oils are another option too. And so just by lighting a candle or having essential oils, number one, is going to bring you into that oxytocin relaxed state. Number two, it's going to encourage fuller, deeper breathing, more relaxed breathing instead of shallow, quick breathing. And breathing is important for many things: respiration, circulation of blood flow, diaphragm, mobility, lymphatics, GI motility, continence, postural stabilization, movement control, limbic system downregulation. It contributes to the elasticity of the pelvic floor and it mobilizes your thoracolumbar muscles. So important that we're just, not caught up in a stressed out state, driving around or just throughout the day caught holding our breath. We want to just be relaxed. So if we think of the diaphragm and the pelvic floor, when we inhale, that diaphragm descends down so that our lungs can fill. So then the pelvic floor has to descend down too. They kind of pair and match each other. They mirror each other. And then during an exhale, that diaphragm quickly ascends up. I shouldn't say quickly, only if we're talking about the sneeze or cough. And then the pelvic floor ascends up. So whenever it's a relaxed exhale, it happens slowly. Whenever it's a sneeze or cough, it's a quick elevation. And I like to think of it as an elevator. So normally we're on the ground level, our pelvic floor is resting ideally, hopefully. And some of my patients with pelvic dysfunction, they are actually in a tense state in that pelvic floor. So they're on the first or second floor. Hopefully just the first floor. Hopefully they're not as high as the second floor of tension, like in a sneeze or a cough. And then whenever we inhale, that pelvic floor should go to the basement level. It should expand and stretch and then recoil. Barriers to balanced breathing would be if you're not fully exhaling, then the pelvic floor can't fully recoil into a relaxed state. And this is important for diastasis, prolapse, or incontinence. If you don't fully inhale, the pelvic floor can't lengthen or stretch. So, thinking of things like, is your bra too tight? Then that's going to limit how much you inhale. Abdominal gripping, too, just holding, your stomach in because you want to look a little more toned, is going to keep that tension in the pelvic floor, too. So, it's not going to relax. So, I teach women, let the tension go in the abdominal region. Which I understand can be like a hard thing because if you're self-conscious about your weight or things like that. But number one, we want to be able to function well. And then number two, once you're functioning well, we can work on engaging well and building, core stability and strength and changing maybe the cosmetic look of your abdominal region. Next, rib flaring instead of umbrella expansion. I already talked about that one where you're just kind of breathing with the chest rising, not expanding laterally with ribs. Also, restrictive waistbands, tight pants can affect that too. Posture, that's going to be really important too. Obviously, when we're pregnant, we're going to fall into that sway back position a little bit because that rib cage has to translate posteriorly. So to make up for the center of gravity of baby and your belly shifting anteriorly. Otherwise, we would tip over. So when you're standing, this is more postpartum things we're working on. Are you flaring your ribs? Are you shifted posteriorly? One easy way to correct is just with a forward lean, like a Michael Jackson lean. And then after you lean forward, come back to neutral, and that's gonna stack you back up. We can put our hands in a diamond position on our hips to see if we are in a stacked position. Anterior pelvic tilt is something that a lot of women used to be kind of like aware of. It was a trendy, sexy term of, oh, I have an anterior pelvic a tilt. We need to fix that. I guess more so it was PTs thinking that. But again, it's really that posterior rib translation making it seem like an anterior pelvic tilt. And I use this postural corrective kind of guidelines with not just my pregnant or postpartum patients, but I mean any patient. We want the body stacked to function well. So if you're having back pain or neck pain or knee pain, let's take a look at your posture and see what's going on there. Next, we'll go over better bathroom habits. So if you're in the habit of speed peeing or speed pooping, you need to stop that right now. We are not to be peeing as fast as we can in a rush, unless, it's extenuating circumstances. Also, not hovering on the toilet, but instead use, toilet paper to cover the public seats. Don't Kegel. So, like I talked about, stopping midstream, that's okay to do once to figure out, oh, that's my pelvic floor muscles. But I don't want you to do that repeatedly because you're in a stretched position when you're on the toilet, and muscles, again, they don't function well whenever they're too shortened or too lengthened. A great example of this is if you squeeze your fist right now, you have a nice and strong grip. Now, if you cock your wrist forward and try and squeeze, it's really weak. And if you cock your wrist backwards and try and squeeze, it's really weak. Next, don't hold your breath with bowel movements. We've been over that one already. Use a squatty potty that's going to position your colon in the best position to evacuate, and with a little forward lean is good too. Normal frequency should be 2+ bowel movements per day. If you're not having regular bowel movements every day, number one, it's not detoxing estrogen from your body, and number two, it's just causing a lot more strain when you do have bowel movements too. Normal urinary frequency is every 3 to 4 hours or 5 to 7 times a day. Um, Ideally, we should be sleeping through the night. I can say I'm not doing that right now being pregnant, but you just got to roll with it. It should be effortless to start and end a stream. Also, no just in case pings. So, you're about to go run errands, even though your body didn't tell you it needs to go to the bathroom, your brain's saying, oh, well, I don't want to go in public, so I'm going to go at home. Why we don't want to do that is because just in case peeing messes with your brain's signal of knowing what full is. And so then as you continue that habit day in and day out, you develop some urgency because your brain kind of forgets what full is. We also want to identify links to bladder irritants like alcohol and coffee. Drinking less liquids too does not always decrease bladder sensitivity, because think about it. If you're drinking less liquids, you're actually not diluting your urine down, and it's very concentrated, and that can be more irritating to the bladder. So especially in nursing homes, this is common too, or in jobs where people just are very busy during the day, like teachers. They won't drink as much because they don't have as many bathroom breaks available, and so that's just not good. I understand you have to just do the best you can, but if there's a way you can get someone to cover your breaks or things like that, or teach the kids what to do, work on silent reading while you go to the bathroom, then great. Okay, next we'll go over stress incontinence. So stress incontinence happens when physical movement or activity such as coughing, laughing, sneezing, running, jumping, or heavy lifting puts stress on your bladder, causing you to leak urine. Stress incontinence is not related to psychological stress. Just a little clarification there. So a lot of my CrossFitters deal with the stress incontinence and powerlifters because they're just not able to handle the demands of the body weight or the barbell. Their pelvic floor just can't hold any longer. And so it doesn't matter if it's a little or a lot, leaking still can be addressed. And then the other one is urgent incontinence. So urgent incontinence is characterized by loss of urine that is associated with a sudden, strong desire to urinate that cannot be postponed. Other symptoms include a need to urinate frequently and waking often during the night to urinate. And this is known as overactive bladder. Urinating is a complex reflex that your pelvic floor muscles must let go. Your brain perceives this letting go and understands that you're in the bathroom and on the toilet and ready, and your brain sends a signal to your bladder and tells it to relax so that it tells your bladder to contract so it can squeeze to empty the urine into the toilet. So it's not your pelvic floor muscles, it's your detrusor muscle that's contracting. Your pelvic floor should be relaxed. This is not on any of my slides, but some of the overactive bladder medications can actually really impair your cognitive function and lead to long-term memory issues. So keep that in mind if you have any family members, especially, older adults that are on bladder medications, make sure it's not the one that affects their mental health. Urge suppression techniques. So you can sit or stand and breathe when urgency comes, focusing on slow, long inhales and exhales. Because if we've developed a habit of leaking occasionally throughout our day, then immediately when we feel like we have to go to the bathroom, we're going into this fight or flight state, and your brain's saying, oh, I'm going to leak again, to hold tight, hold tight, hold tight. And so your pelvic floor cannot hold tight any longer, and that's when the floodgates go and you leak a little bit. So instead, by keeping your body focused on that long, low inhale, what does the pelvic floor do? It relaxes a little bit, and then you exhale and it contracts a little bit, and then you inhale and it relaxes. And so instead of squeezing tight isometrically, you're still keeping the function going of that pelvic floor. Next, you can, if you feel like, you're getting to the point where you can put off going to the bathroom, if you've been going a lot, you can distract yourself with a little book or a phone, game on your phone or something. I would say most of my patients with urgent incontinence actually need to be more aware of their kind of body signals, because they tend to be so distracted by work or the computer or phone or things. And so then they kind of put off the body signals the first time and the second time, so that when they do go, they really don't stand a chance. So it kind of just depends on where you fall on the spectrum of are you listening to your signals or not. Next up, visualization and distraction. So, along with slowing your nervous system down with the deep inhales and exhales, start looking at the wall color artwork or things like that as you walk to the bathroom and unzip. Because the more you can kind of keep your mind in a relaxed state as you walk down the hall to the bathroom, the less likely you are to leak. And then the last part is avoiding eye contact with the toilet once you decide to go to the bathroom because your brain has already formed a reflex response of when I see the toilet, it is go time, but we don't want to leak when our jeans are only halfway down our legs. So that's why just avoiding that eye contact will really help. Don't get in the habit of going every time you have an urge. You'll notice a low volume output if you start going too often. So that's really your best way to kind of decide if you're going too often. Is it a normal volume or is it just a little bit that you're urinating? Okay, Kegels or Kegels, tomato. Pelvic floor dysfunction is hardly ever a strength issue. Sometimes it's due to over tight muscles, poor coordination with core and diaphragm, vaginal dryness, nervous system upregulation, hip or back mobility issues, lifting strategies, posture, glute weakness, etc. Kegels will not solve everything. So, if you do need to Kegel, I'll let you know during your appointment. For the most part, 90% of my patients don't need to learn how to Kegel. You need to learn how to relax the pelvic floor. Pelvic organ prolapse. All right. So it's when one or more of the organs in the pelvis slip down from their normal position and bulge into the vagina, which is obviously our canal. Remember, externally is the vulva, the canal is the vagina. It can be the womb, the uterus, it can be the bowel, it can be the bladder, or the top of the vagina. A prolapse is not life-threatening, but it can cause pain, discomfort, and really affect quality of life. So even for my patients who have prolapse symptoms who tend to just clench because they want to hold that pelvic floor tight so nothing falls through the vagina, they still need to learn how to relax those muscles because if you are clenching all day long, eventually the pelvic floor fatigues out and then you do become very symptomatic. So, number one, teach them how to relax the pelvic floor in that side lying position. And then number two, going through breathing patterns of exhales and inhales under load, under pressure, like doing a bridge. And then there's other things we can do too, like hyporepressives. A good thing to note is just based on your degree of prolapse doesn't always signify what your quality of life is going to be. And then number two, if you are failing, I shouldn't say failing physical therapy. If physical therapy is not completely resolving your prolapse symptoms, then there are things like pessaries we can put in the vagina, which is basically a splint. There's providers who do pessary fittings. And, a third option would obviously be surgery and pelvic floor surgery, but we really, really don't want anyone to go down that route, and I haven't had any patients that have gone down that route. 6 factors that influence prolapse are going to be that pelvic floor muscle tension, scar tissue, poor pressure management, bearing down, and straining and not engaging the core and pelvic floor for lifting, poor bowel and bladder habits, so sending pressure south by bearing down, posture, hormonal changes, and I think I already talked about the rest. Oh, connective tissue hypermobility. So if you're hypermobile, which we can examine via the Baton test, it may be necessary for you to have pessary or you may need surgery. But even with my hypermobile patients, we've had some success with some of my patients doing the conservative PT route first. Nutrition in pelvic conditions. So, clinical presentations of cyclical yeast or recurrent yeast infections or vulvodynia or vaginismus can be caused by a high oxalate diet. Examples of oxalates or foods high in oxalates include nuts and legumes, spinach, elderberry, figs, coffee and tea. I think chocolate's one. So there's a long list on Google you can find. And there's a great book called Toxic Superfoods: How a High Oxalate Overload is Making You Sick. So whenever patients are coming and they're having these symptoms and they've been on antifungals and things just keep coming back, things like that, we can try transitioning slowly out of a high oxalate diet. Not a quick transition, like not completely cold turkey, because then you can experience oxalate dumping, but a slow transition coupled with taking calcium citrate to bind those circulating oxalates and adding B6 or even a B complex and adding a probiotic. In some cases, patients may need the antifungals again, even if the results were negative for fungal infections. But this is just an amazing little nugget of research I found when I was taking the organic acids webinar. And the organic acids is a functional lab test we can do to assess your oxalate load. Pharmacological considerations. Oh, I did put it in here. So, overactive bladder is a common disorder affecting 33 million Americans and 30% of people over 65. Research suggests that one of the most popular overactive bladder medications, oxybutynin, may harm brain health and increase dementia risk. So, big red flag there. Don't take that one. Don't take any of them. Do pelvic PT. And then just wrapping up here, here's some great pelvic PT resources if you want to learn more on your own. Genesis PT in Texas, they're great. They're expanding all over the country. Pelvic Sanities in California. She has the Pelvic PT Rising podcast. Alexis Morgan, she's with Physio Ice. She's a great instructor for a pelvic floor class. And what to expect at a pelvic appointment. So first, I go over your concerns as well as your medical history. Then I'll review your goals for physical therapy. We will discuss whether or not an internal exam is recommended. If we find trigger points, tender points internally, then I usually give you that for homework to release. You can do self-massage at home with your finger or buy a pelvic wand. So Intimate Rose is on Amazon. They make a great pelvic wand. Just like any muscle, we need to release the tension. Whether or not we do an internal exam is totally up to you and your comfort. I would not do any on a teenager unless the doctor was very specific and adamant that a teenager needed it, because I think that's just a little too invasive at that age. And then I check for other strength or length issues and the rest of the body that could be related. And then after that, we go into corrective exercises or bladder retraining techniques that you can do on your own in between appointments, and then we'll schedule your next appointment. So it's just real easy. If I did an internal exam, I'm just going through 3 layers: first knuckle, second knuckle, third knuckle, as far as depth. And then I'm just kind of following a clock pattern around to compare left to right, up to down, and see if there's any difference side to side. And then in closing, it's time for you to take action now. So get help if you had 3 positives on the Cozyne pelvic floor dysfunction screening protocol. Share new information that you learn with at least 2 other women in your circle that may benefit, or just initiate a conversation, because most women are too embarrassed to discuss. It's too taboo, but it's really affecting their quality of life. Remember the umbrella breath. Practice good bathroom habits. I didn't put this one on the slides earlier, but don't blow your nose on the toilet either, because that's sending the pressure south to your pelvic floor that's already in a stretched position by sitting on the toilet. So wait till after you go to the bathroom to blow your nose. Find a balance of stretching and strengthening, and build your wellness team. So, there's so many practitioners out there that can help you find optimal health. And then text or email me if there's any future class topics you want covered. That is my old phone number. The new one is 318-202-2344. And then I'm also on Instagram, CalhounWellnessCollective.com. Website, you can book instantly at CalhounWellnessCollective.com too. Thank you.